Recently, I have received a book written by Dr. Gaurang Gaikwad, the most passionate homeopath and renowned teacher in homeopathy. This book I have received 2 days back. This book, Sarcodes, Hormones, Neurotransmitters and Matridonals. So this book basically, what I find is, initially I was using his book Matra Medica of nosodes and sarcodes. And this book also contains some part of this bowel nosodes also. I have got these 2 copies of this particular book and I use this in my both OPDs, and I use frequently in number of cases. Like example, like in pituitary gland, where there is a growth, development, retardation, I use this pituitary gland as one of the intercurrent remedy with indicated remedy. I also use anterior pituitary as seen in some of the cases of hypothyroidism, where TSH, patient is better but TSH is not going down. In such case, I use anterior pituitary. I use also remedy like folliculinum, where there is a theme of sarcode with features like lichen and sepia, where in this case you have got a lot of domination and been abused. I use this folliculinum as one of the best medicine as intercurrent medicine. I also use insulinum in cases of diabetes mellitus with very chronic skin conditions. So insulinum acts as one of the best intercurrent remedy in cases of diabetes with skin complications. I use with some of the menopausal complaint. The best remedy I find is uperinum in patients with lot of symptoms of menopausal symptoms. I also use bowel nosodes like dysenterico in some of the cases of IBS. So this book has got lot of use in my day-to-day practice. And when I received this book, when I gone through this particular book in detail, and I find it is one of the desirable expansion of this particular book. So this book basically what I find is expansion of this book of Matra Medica by Sarcodes and nosodes. And in this book, he mostly talks about sarcodes, hormones, neurotransmitters and matridonals. And basically when you talk about this, all these drugs which are given in this particular book are basically prepared from healthy tissues. And what is use of this particular book in practice? What I find, you can use these medicines as an intercurrent medicines or as a part of the blockbusters when the indicated remedy stops working in few of the cases. Or you can use this book as these medicines as one of the state remedy, or you can use these remedies as one of the deep constitutional remedies. Some of the example of this remedies from this book, like DNA. So this DNA is useful as a genetic, in cases of genetic and developmental disorders, where you have low confidence, irresolution, feeling of being lapped, just like Barata-like state, but you have got this sarcode-like state, you can think of remedy like DNA. Another remedy like dopamine, which is mostly useful as one of the remedy in ADHD cases, behavioral problems in children. Remedy like hypothalamus, you can think as intercurrent remedy in case of PCOD, when other nosodes like thyroidinum or folliculinum has failed. You can think of insulin-like remedy, where you have a child who is obese, child who has got late dentition, child with large head, child with pot-bellied abdomen, and he has got craving for sweets. And just like you are thinking of sacrum album in a case, but this also has got irritability like sina. You can think of this remedy like insulinum instead of sacrum album, and if you have a combination of sacrum album and sina. Oxytocin like medicine, which is very close to phosphorus, but when you think of this, like it has got phosphorus like state, like need for bonding with the people. Another remedy which is the secretion of pancreas like pancreatininum, which is useful remedy in cases of gastroesophageal reflux disorders with lot of flatulence and diabetes mellitus as an intercurrent medicine. This is best medicine also in cases of dyspepsia. Parathyroid like medicine you can use as intercurrent in cases of recurrent renal calculi when your regular medicines like Barbaris vulgaris calcarea fail. Another important part about thyroidinum, what he mentions about this patient is chilly, patient has got allergic manifestations, patient has got intense craving for sweets, and patient has got quarrelsome with family like Kalika. You can think of thyroidum. Another important remedy what I have seen in this book is melatonin. See, melatonin to be prescribed in cases where you have a patient with prolonged sleep deprivation or loss of sleep, elements from a lot of caring and nurturing about loved ones, chronic fatigue state. So this medicine might be useful in cases of medical students who have got a very hard studies during examination, students with MPSC or UPSC, or you can have this remedy is very close to calculus-like state where calculus patient has got a lot of history of night watching, loss of sleep and intense caring for loved ones. So this you can think of remedy like melatonin in these cases. Most important part as far as this book is concerned is clinical repertory. So in clinical repertory, you have a direct indications at some of the indication like dry pregnancy. You can think of remedy like amniotic fluid. In cases of autoimmune disorder like lichen planus, psoriasis, you can have a remedy like histamine. Most important part of this book, what I find, is clinical cases, and all the clinical cases where Dr. Gaurang has used his best way of artistic way of repertory. So he is one of the person what I find he has got good repertorian with lot of, he plays just like Dr. Phatak with the repertory. And all these cases are given with the all follow-up studies of investigations. One of the case which is given here is one of the case of autism with developmental delay, but this patient is improving with remedy ignitia, but case gets standstill, and then they use the remedy pituitary gland, and with this patient got improvement. Another case of chloasma in female, where she get better with remedy colophyllum, but again case becomes standstill and they use the remedy posterior pituitary, and again this case becomes improved after prescribing posterior pituitary. So we have got such a lot of cases which are given by Dr. Gaurang and his team. He also mentions like clinical prescriptions of sarcodes. So directly mentions folliculinum 30 BD for 2 days before and after ovulation. So you can think of like you can use this folliculum in cases of like in case of sterility where there is a problem at the level of ovulation. You can use folliculum before and after 2 days before and after ovulation. So he also mentioned a lot of abbreviations about the difficult words in this particular book. And again, the important part of this book is also that this one particular sarcode, its source and who is proved by which people. So we can go to directly to the source books and again study this particular sarcode. So this book basically you can utilize in practice when you find your indicated remedy fails to act or stop acting in a long continued cases. But this remedy that acts as a part of the intercurrent medicines. So this particular you have to study this book as an unpressurized physician, and then you can realize that this book has got its importance in homeopathy practice. One must have got these 2 books at your desk during your clinical practice, and it's really helpful in homeopathy practice in most of the cases where you find blocked in long-standing chronic cases.